I'm Dr. Dr.Janaarthanan, Consultant Orthopaedic Surgeon. Today, I'm going to talk to you about fractures. What is a fracture? By definition, a fracture is a break in one's bone. It could be either due to fall or it could be due to a high velocity incident like a road traffic accident. In certain age groups, in older patients, the fracture is sustained due to very minimal injury. That is because the bone is very fragile and we call them fragility fractures. Break in a bone is not an unusual thing. It's something fairly common we see on a day-to-day basis. What are the symptoms of a fracture? You get excruciating pain, you get a swelling at the site of the fracture, then there is usually a deformity as well at the site of the fracture. So if you do any of these symptoms after a fall or an injury, you need to take urgent medical consultation. When you reach the accident and emergency department of an hospital, they will probably immediately examine you, give you sufficient analgesics, make sure that the distal pulses and the neurovascular status is adequate, and then order urgent X-rays. The X-ray is the most simplest and the easiest form of investigation to identify a fracture. Once an X-ray confirms a break in the bone or a fracture, then immediately the orthopedic surgeon is called upon and your treatment will start. Now these fractures could either be simple ones or complex ones or due to pathological causes. Very rarely the fractures could be due to some sort of a pathological illness. For example, it could be a metastatic cancer or it could be something like a multiple myeloma. So if there is a suspicion of that, then you should take adequate treatment for those pre-existing illnesses as well. Most often, simple fractures are managed in a plaster of Paris cast. But if the fracture is very malaligned and sort of deformed, then it probably might need a manipulation under an anesthetic, and in some certain cases, they might also need surgical fixation with appropriate implants or devices. So if you do have a break in a bone or a fracture, you need to take urgent advice from an orthopedic surgeon, because when you delay your treatment, the prognosis and the outcomes might be totally different.